So, I would like to move on to talk about labor pain management.
Yes.
So, for someone who's pregnant, for a pregnant mom, labor pain is really scary to think of. How is it going to be? Will I be able to bear the pain? And what would be my pain endurance level? Should I take up the labor pain management options? Or like, should I go for the painless labor? Or should I just go with the flow, without any epidurals or other options? So, so what do you think about it? Like, are there any side effects when someone opts for such a painless labor? Um, or in the future, since you're a scientist and you've been doing a lot of inventions, side effects without any side effects, like you've invented so many products.
Yeah.
So, is there something that would come up? Anything that you have on that regard?
Yeah, no, good question. Number one, I think this is completely a very individualized decision. Like women need, I'm a big fan of women being their own evangelists. So I think women are very well equipped to make these decisions and they need to be given the information. So you guys are doing the right thing by giving them that. Is labor painful? Yes, I'm a man. I would never know, but it looks painful. And I think women do an amazing job
Yeah.
because I don't think I'll be able to do the same thing. So I think it's an amazing job that you guys do. The second part about it is it safe? No, basically there's no such thing as nothing that we give as doctors is ever safe. Even Panadol has side effects. But the question is the risk
Okay.
associated with what we give better than
Hmm.
whatever else you're going to experience? So if pain is a problem, it should never be a
Yeah.
reason to actually have that mindset. I think the best way women can encounter this is attend your antenatal classes, understand what you're going to be in for, so that you have an expectation. Some women do birth plans. I always like to say, 30% of women, at least in Australia, end up with cesarean sections. That's the norm. All right. So at least on baseline. So it's not a common. It's a common thing to happen when you go in labor. So you want to have an idea, but you don't want to have a rigid plan. Come up as long as you're doing what's good for you and the baby. I think that's a good idea. All right. And in terms of medications and drugs,
Okay.
everything has risks associated
Hmm.
with them, but these are things that have been used for years in pregnant women. All right. And I think that balancing the experience you're going to have of labor, increasingly we are seeing things which are called birth trauma, where women actually have trauma or PTSD from their delivery. And this is becoming a bigger problem. Right. So I would really advise
Okay.
anybody, if you think you're in that much pain, don't use the factor that I really want painless or no medications to be the deciding factor.
Painless.
If you're in pain, you should take pain medications. There are very good anesthetists who can do, spinals, epidurals, can give you medications. Drugs like morphine and things like that have been, at least in the Western countries, have been used for years for pain relief. And it really helps you have that, it's about control of your own labor. And I think, this is always in the patient's own hand. As doctors, I don't think our job is to tell you this is the right thing to do, because I think all of you all are educated enough and have enough self-determination to know what's good for yourself. So, you know,
Yeah.
ask questions, ask a lot of questions. That's what other people I think
Uh-huh.
answer like this. And
Hmm.
I think you probably make the right decision. Yeah.
What's your perspective to it?
Yeah, good question. Actually, I have an answer for the last question about the new technology, but I completely forgot to talk about it. Anyway, we
Okay.
uh, can I talk about that
You can
first?
go ahead. Yeah.
So actually, in
Yeah,
labor,
yeah, sure, sure.
another thing that we've actually done very early studies on is the use of virtual reality to actually help mothers reduce their pain,
Yes.
and it looks really good. So it's actually it's very safe.
Oh, that's great.
Very safe. It has
Yeah.
it has a low side effect profile, but it's just digital therapy. And actually, they've done a study. We've done some studies. We've just published a paper on that. And how it really reduces pain in an in-hospital setting. There's another group in the US that actually use it in early labor, and their results are fantastic. So I think this is something that mothers should be on the lookout for, whether they can actually use virtual reality headsets in early labor in particular. I mean, it's very new technology. You can buy it off the counter. You can do whatever you want with it, but it's something that appears to have some benefit. Right? The clinical trials are some time away. You'll see it in the next 3 to 5 years, but this is something that could be done in the
Exactly.
future.
I wish I had virtual reality when I gave birth because I went for a painless I went for like I went through the pain. So I wish I had this virtual reality to overcome during the active labor.
Yeah.
It sounds
No, I
really
mean the
interesting.
yeah,
Yeah,
yeah. So I mean, the feedback from the patients has been fantastic. I think when we did it here,
yeah,
this is another trial, not in labor, but we did it in a procedure, and I think 80% of mothers said they would have it again. 90% says they would refer it to a friend. It's really high. Like they really enjoyed it, and I think it really. I
that's
mean,
wow.
yeah, it's a good distraction. I mean,
It's amazing.
so yeah,
Yeah, yeah.
yeah.
Better
To
than
answer your
music and meditation.
yeah, no, look, I think it works in very similar ways in the brain if you look at the studies. So,
Mm.
but I think it might be the way of the future. You might be giving birth with a virtual reality headset on you. Well, not giving birth, but at
Yeah,
least in
that's
the
great.
early stage of labor, have a virtual reality headset.